I'm Jawad. I'm the Executive Medical Director at East Lancs Hospital NHS Trust. This is my update on the 10th of June 2021. I'll begin with the numbers of hospital admissions, which unfortunately has gone up since I last updated you all. As things stands, we have a total of 34 patients who have been diagnosed with COVID in the hospital, and of these 10 are in the intensive care unit. Now this is worrying because as you'll remember, a good few weeks ago we had handful numbers in the hospital and nobody in intensive care. So it just highlights the fact that COVID-19 is still causing problems. And the request, as I've always been saying, is to please follow the infection prevention and control principles. So hands, face and space, use masks, be at a social distance, and hand hygiene. These are very, very important measures to help reduce the spread of the infection. Now, in keeping with what is happening in hospital, it probably reflects the increased number of people being diagnosed with COVID positive in the community, and I'll run through some numbers with you. So in Blackburn with Darwin, we have 620 people per 100,000 who've been diagnosed with COVID. Burnley is 292, Hyndburn 315, Pendle 206, Ribble Valley 316, and Rossendale 340 per 100,000, and that takes to a total in our conurbation of 380 per 100,000. This is quite high transmission rate, and we have to be mindful that unlike the first time where we had the Alpha variant, also known as Kent variant, this time it is the Delta variant, again also known as the Indian variant. The transmission is high in that variant, and although a huge number has been vaccinated, vaccine doesn't protect 100% of the people 100% of the time. The effectiveness of vaccine at best is 90%, having had 2 doses. So please do remember that 10% of people who've been vaccinated could be the non-responders, and hence the importance of what I've mentioned: hand, face and space. Now, the government has put in initiative with surge testing. The cohort of population who can have vaccination has also been reduced now to the age group 30 plus. So if you are getting the invitation for vaccination, please have those vaccines. We are seeing younger patients being admitted to hospital, just not to the general ward but to intensive care. So if vaccination is being offered, please do take it up. At the same time, we are seeing an increased number of attendances to our accident and emergency and urgent care department. Now, this has an impact on functioning of the hospital, but also has a potential of transmission of virus between people who present to these crowded areas. If I can mention that before COVID, at our hospitals, we used to have about 500 to 550 attendances per day. This time, we are seeing more than 600 attendances per day, and there have been days where we have had 700 people attending A&E and urgent care. This puts a strong pressure on the system, which is trying to do its best to deliver the right care to the right people. Hence my plea is that there are contacts outside hospital where patients and public can inquire about any worries they have. It starts with 111. Your GP surgeries have got extended hours and more appointments. So please utilize those. Pharmacies are also in a position to help resolve some of the queries you may have. We are seeing again increasing number of children attending hospital, And I would say on this that please first attend your GPs to see if the child really needs to come to the hospital, because 70% of these attendants do not need to be in hospital. They are being seen and being turned around with advice. So please think wisely on, do you really need to be in the accident and emergency and urgent care departments in hospital? Finally, we are continuing to put our efforts in restoration work to try and reduce the inequalities that COVID has resulted in treatment options. We can only do that with the help of our partners in the community and population. Our staff is working 24/7 to help deliver that care. But please bear with us, because we haven't got the resource to address all these inequalities in a very short space of time. It will be spread over times, and we are using clinical priorities to help deliver the treatment to the people who require it the most. Thank you very much. Be safe, look after yourself, and do the right thing by following the principles of infection prevention and control in reducing transmission of this virus. Bye for now.